At any given time in the hospitals and the Alberta Health Services, the emergency units have a considerable number of patients that are not only waiting treatment in emergency, but are also waiting beds on the inpatient units. We're finding that we're in a situation where access is gridlocked due to the number of patients waiting. Medical assessment units are a unit that is in between the emergency department and the inpatient unit. This concept enables us to move patients from the emergency department into an inpatient setting and immediately begin consultations, treatments, diagnostics, and then move these patients on up into the inpatient area or discharge them home. The medical assessment unit is staffed by the same professionals and support staff as an inpatient unit, and that includes the physicians as well.
For patients, we hope there's no real difference at all. We recognize that patients will move from the medical assessment unit onto a regular medical inpatient unit within hopefully 24 to 48 hours. We feel that the patients will receive more timely care, more expedited consultations with our experienced medical staff, and overall hopefully decreased length of stay as a result.
There are patients who need more than 4 or 5 hours of treatment in an emergency department, but who don't really require 2 or 3 days of inpatient hospitalization. So these are the kinds of patients that we're trying to treat in a clinical decision unit. It's in the emergency department, and it's an area where we can take patients who would otherwise require hospitalization and aggressively diagnose them and treat them so that they can be hopefully discharged from the emergency department within 12 to 24 hours rather than requiring hospitalization. The clinical decision unit is staffed by emergency nurses who are specifically trained to work in the decision unit, and it's covered on a 24-hour basis by emergency physicians who can reassess patients and make treatment decisions and admit or discharge patients whenever it's necessary to do so. So clinical decision units improve access to emergency care and hospital care in 2 ways. First, they allow us to treat a number of people in the clinical decision unit rather than hospitalizing them, and this frees up hospital beds for patients who really need them. The other way that clinical decision unit help is that they allow us to treat people in shorter periods of time. Even 4 or 6 hours difference in a hospital length of stay can save hundreds of hospital beds every year for patients who need them.